Hi again, it's Rcbrotman, the recovery coach. Remember, I'm always here for you. Just give me a call. Let's talk about your drug or alcohol abuse and how we can make you better. Funny thing happened today. I was with a client and we were talking about entering into a treatment center. And unfortunately, his insurance only covered one center in South Florida where I treat. And he spent about 7 hours at the center, went through all the entrance procedures and all the paperwork and all that stuff, the interviews and whatever. He was planning on doing a 5-day detox for opioids. And 7 hours later, he was told that he couldn't get into the 5-day inpatient program to detox. Fortunately, he had been seeing his pain management doctor who had put him on Suboxone several days before that, so the detox isn't so bad. But I just want to talk to you a little bit about incidents like this. Of course, there's several alternatives for treatment. There are 3- and 5-day detox programs followed by either an extended outpatient program or something that's called a partial program, where you spend 7 or 8 hours a day in a center and go home every night, that type of thing. And quite frankly, the types of treatment centers that are available are really varied. As I said, they go from 3 to 5-day inpatient programs to 30 to 90-day inpatient programs, and a whole myriad of outpatient treatment programs, especially today, where in my other video I mentioned medical addiction treatments, and especially when they're giving out medications, things like Suboxone, Subutex, Zubsolv, where you can take the medication home with you and take it on your own. Those are also alternative type of programs. But insurance is important today. Unless someone can really afford a 30 or a 90-day inpatient program, they're kind of limited. And 30 to 90-day inpatient programs cost anywhere between $20,000 to, in some cases, $87,000 a month, depending on where in the United States you are and the type of program you want to have. As I mentioned, my patient today limited to one treatment center based on his insurance. They would not take him as an inpatient. So he's going to start an outpatient program on Monday, and 3 days a week he's going to sit there for, have groups for 5 or 6 hours a day. And I'm pretty familiar with that program, and I think it'll work for him. But it did trouble me a little bit, because based on the insurance coverage and things like that today, we're limited to how we can treat our patients. Again, I'm Brotman. I'm the recovery coach. I work basically in South Florida, Palm Beach County, Broward County, as far as north of Stewart County. But I do travel all over the United States to see people. I see athletes and business people, housewives and students. And give me a call if you have a problem, or my phone number and my email address is posted in the comments on this video. And in my next video, I'm going to want to talk a little bit about aftercare treatment programs like Smart Recovery or Alcoholics Anonymous and things like that. But again, the first step in the treatment program is a detox or a residential or outpatient program to stop the drugs or alcohol. That's the first step in recovery, and we'll talk about more later.